Hello, my name is Verdy Wijaya. I'm from accounting. Today in this video, I will talk about THW take the pill. In this topic, I'm on contra side because I'm not agree with the pill. Now I will start. Barbiturates are a type of sedative drugs to reduce activity in the brain. The use of barbiturates can be given before surgery, treat seizures, or treat symptoms of anxiety disorders. Sometimes barbiturates are also used to treat sleep problems. Barbiturates are drugs with a high risk of overdose. The level of tolerance and dependence of this type of sedative also varies. Even more dangerous, a person cannot stop taking barbiturates suddenly because it can trigger a negative reaction. These are chemicals that provide a sedative or calming effect. The effect of consuming barbiturates can occur in the short to long term. When a person is to taking barbiturates, tolerance and dependence will be formed. This means the sometimes large doses are needed to get a similar effect. In fact, consuming barbiturates in high dose is quite dangerous because it can trigger an overdose of barbiturates. This is why barbiturates are now not widely prescribed as sedative. This also makes the process of stopping taking barbiturates not easy to do. If done suddenly, it is possible to appear with withdrawal symptoms. This type of sedative is usually used to treat. The one is excessive anxiety, anesthesia before surgery, insomnia, seizure, anesthesia, tension headaches. However, generally, barbiturates administration is only done if other drugs are not effective. Especially for the administration of barbiturates for insomnia, this is less often done. The form of barbiturates drugs can be in the form of injection, liquid, tablet, and capsule. The combination and dosage of barbiturates are also different. Consuming barbiturates should only be done with a doctor prescription because they are prone to drug abuse for improper purpose. Some of the common side effects that arise after taking barbiturate drugs are sleepy, headaches, difficult breathing, chest pain, rash, fever, joint pain, swollen face, lips, and throat. A person should not take barbiturates if they are going to do activity that require high concentration. Examples include driving or operating heavy equipment. When symptoms of side effects appear, immediately consult a doctor to look for the alternative drugs. Barbiturates overdose risk factors. In some conditions, this is a risk that a person is more susceptible to a barbiturates overdose than others. These factors include age, health condition, or consumption of other drugs at the same time. Furthermore, barbiturates can add a calming effect when taken in combination with other medication, such as allergy medication, pain reliever, alcohol consumptive. Next, are several studies that mention a correlation between the use of barbiturates during pregnancy and the possibility of birth defect. Babies can develop growth complications if exposed to barbiturates in the long term while in the womb. In addition, babies can also be born with dependence on barbiturates and experience with withdrawal symptoms after birth. In a laboratory test on rats, exposure to barbiturates led to brain development problems, particularly those related to learning, memory, and other important functions. Some of the withdrawal symptoms they may appear include nausea and vomiting, stomach cramps, hard to sleep, problem focus, heart problem, seizure, tremor, delirium. So this is my contrast side in this topic. Thank you.